thing going on here. How many of you have been with the NFP program since the beginning of the mandate? That's awesome. Fantastic. So one of the blessings that we have is we have this diversity of methods available in our diocese. We have 4 different methods present in the Diocese of Fargo, and each one has a unique and particular contribution. The science of NFP is really a gift of the sexual revolution, in the sense that because of the creation of the pill, there was the recognition that we need to be able to look at the science of fertility and try to help couples know how they can manage their families, they can plan their families in a way that respects God's plan for marriage and sexuality. So the science of NFP is really, I believe it was in the 60s that some of the initial science first came forth. And so this is really a new thing in the history of the church. And you guys are pioneers in this movement. And there are, as I said, there are different ways of approaching NFP, and each one has specific gifts to give. And the church is consistently calling us to recognize the beauty and the diversity that we have of the gifts that God has given. The sower who spreads his seed wide, and it sprouts in so many different areas, in so many different ways. And so I wanted to take this opportunity for you as NFP teachers to become aware not only of your own method, but what other methods there are out there. Part of the USCCB certification for our NFP program calls on teachers to be willing to refer when necessary to other methods. And I think that's one thing that Rochelle has done a great job of, is cultivating this sense of collegiality in our NFP community. There's not this competitiveness that there can be in other places where sadly they feel threatened by other people who are on the same team, which is a shame. And so I'm grateful that that's not the reality in our diocese here. And so as part of this effort to kind of allow you to see more richly what's available in our diocese, I want to have a brief overview of the 4 methods and kind of the highlights, the things that are particularly unique about those methods. And so what we're going to do is we'll start off with Dustin and Stacey Coles, who teach the couple league Sympto method up in Grand Forks, and just give a brief overview of what couple league has uniquely to offer. So if you guys would be willing to come on up now.
It seems like, from our observation, couples come in not fully understanding really what natural family planning is all about, thinking it's just a diocesan requirement, maybe just learn about the biological science, and sometimes it seems like maybe the men would be, this is the woman's thing, right? And so she's just going to check the signs, and I'm just going to be along for the ride. So just the power of the witness of a couple to let them know that this is really a journey together. This is a cultural way of life. And it's way more than just the biology, it's the relationship, and how do you love one another day in and day out, during the fertile and the infertile times. How do you witness authentic love? How do you pray and discern together? Because NFP, as we know, detached from God, detached from prayer, really can take on elements of unhealthiness and even can be used as a means of birth control. So I think it's just that power of that witness and encouragement to them, letting them know that we've talked to, certain couples, one in particular that I'm thinking of, and, sometimes the women can feel alone and isolated in this journey if the man isn't by them. So I think it's important, that mentorship quality there, and that's one of the strengths of CCL, is just encouraging them to move together.
It's set up with 3 classes that are set a month apart, and each class is about 2.5 hours long. That allows us to reach more people at one time. It does pose a little bit of a challenge sometimes in that one-on-one and building their relationship with them because you're in a group setting, but we do split the class in half, and halfway through we do chart consultations with them and sit down with them one-on-one and answer any questions or concerns they might have, check through their charts and see how things are going. We also offer supplemental classes, postpartum, and then the other one is premenopause. And so those can be taken separately at a time when it is pertinent to the couple. There is also an online option for those who might be living in different areas at the time when they're preparing for their marriage and they can't be together for a class. There is an online option where they can watch a teaching couple online, and then they get connected with a personal teaching couple within the area who can answer the questions and help them with charting and just be that face on a personal level with them. When we are going through the charting with them, the CCL teaches the Sympto method, which is we're looking at 3 different signs. So they're charting the mucus, which is kind of across the board with all of the methods. But they're also charting the temperature sign, as that's changing as well throughout the cycle. And then the third sign that some women find helpful to look at is the cervix and what that's doing during the fertile time. So all 3 of those can be looked at and charted, and there can be a cross-check, especially if one doesn't seem to be giving you a normal pattern or working for some individual for some reason. There's a cross-check with a couple other signs and symptoms. Also, CCL offers, they offer, with your first year membership, and then after that, if you choose to continue membership, you can, but they send out kind of a magazine that comes out bi-monthly, and it just kind of encourages you and gives you testimonies of other families, couples that are practicing NFP, the joys, the challenges, the struggles that come with it. There's always a section in there that gives a testimony from another teaching couple and how they came to practice NFP and their conversion in that. And then they hit different hot topics, like this one is more on, romance that endures throughout later years, ready for another, and kind of that discernment process of, are we ready for another child? Another one was the pains of miscarriage or infertility issues. And so they always kind of have a main topic that they're broaching in that month's issue. And then at the back of that, they also have chart interpretations, and they'll put up different charts that women have sent in with extra questions and maybe some more challenging charts or issues, and it helps you to discern and decipher your own chart. So there's kind of an extra support that's available through the Couple-to-Couple League.
And another positive is that they do a really good job talking about theology of the body. And again, why are they really spell out not only that the church requires it, but why does God want us to practice NFP, and how can we grow in love with God and receive His grace in that sexual embrace, and how can we respect one another's, freedom and the other person becomes total yes in that moment. So, I know for Stacy and I, when we first got married, we hadn't learned theology of the body, or we were really didn't learn a lot of our Catholic faith growing up. And so we took a class on, out in Oregon, not including theology of the body, and we weren't really inspired at that point to use it, the full-fledged way the church was asking. So once the questions were answered with theology of the body and understood God's grace and all that, it really came together, and we were convicted that, wow, there really is a great opportunity to receive God in this and grow together in holiness as a couple. So they do a really good job of that. And then they also have doctors that present and do a good job of talking about the biology of, sexuality and how babies are created. So, and then the other thing that they do well is really promote breastfeeding, just for really bonding and growing with your child, and talk about the natural spacing and the hormonal aspects of breastfeeding, and how, again, how a man can be a great support to their wives and then let them get it together with families.
The last thing would probably be that a few years ago, they did come out with to be able to chart online through your phone with an app, and so they have Cycle Go Pro for those who want to get rid of the paper charts and do it all online. Much of my talk is
based on a book called The Natural Technology Revolution by Dr. Thomas Hilders, so that is just to let you know this is where some of the information is from. But as Brad said, my name is Leanne Riplinger, and my husband Kirk is here, and we learned the Creighton model about 19 years ago when we were engaged, and I've been teaching for 16 years. So it's been a privilege. And I want to just say, I guess I relate well when there are stories. I can connect to a personal situation. I'll share a little story and then give you a little more overview of the Creighton model, fertility care system. So I've changed their names, but Jenny and Brian came to me years ago when a family friend had told them about the Creighton model system and something that was called nanotechnology, and that maybe could help them. She was struggling with very debilitating PMS, with severe cramping, and it was completely incapacitating her. She would be homesick. Her life dream was to become a mother, and now she found that she and her husband were unable to conceive. So that was devastating. They were referred to so-called fertility specialists, but they were not given any suggestions to how to evaluate or actually treat their situation. They were just told to do IVF. So they were frustrated with that personal encounter that they had, and they wanted to find answers and some actual help. They also knew there were moral issues with IVF, and they didn't want to go in that direction. But they needed help, and they had nowhere to turn. And sure, the Creighton model, okay? With the training program for the Creighton model practitioners, which is what I am, it's a 13-month program that's designed for preparing you as a teacher. It provides education in both the basic as well as the advanced aspects of the system. And it prepares the practitioner to teach the Creighton model system to clients. There are 2 phases of the education. There are 2 7-day duration trainings, 2 supervised practica, and an on-site visit where your supervisor comes and observes you teaching. So it's a lengthy program, very intense, very thorough. There's also a program called the Fertility Care Instructor Program, and that's a shorter one. It's only 7 months long. And that is open to people that have less than 2 years of post-high school education. It's designed to provide only the basic education for the Creighton model system. And these teachers can only teach under the supervision of a fertility care practitioner, so someone supporting them. And that training program includes 1 education phase and 1 supervised practicum. And then if there were more complicated situations, they would then refer to the practitioner to assist them with that couple's needs. There's also a fertility care medical consultant program. And that is a 6-month program that's designed with, again, 2 education phases and 1 supervised practicum that's designed to help physicians to incorporate into their medical practices the newly emerging science of nanotechnology, which we call nanotechnology. So that's part of the training basis of our system. Creighton model is available to both married or engaged couples, single women, or even youth that just want to understand their bodies and their related fertility in a healthy manner. Young women that may otherwise be advised to go on the birth control pill may find valuable information to identify and treat underlying conditions which could further harm them, discomfort them, or even bring infertility into the future. So the Creighton model is designed to work with women of all cycle types, both regular and irregular, long cycles, postpartum, breastfeeding, post-pill, or even premenopausal groups. So all varieties of women can benefit. Creighton model greatly improves the effectiveness in treatment for couples that struggle with infertility as well. And that actually is a fairly high proportion, I would say, of the couples that I work with. Now, with just charting with the Creighton model, they have success rates of 20 to 40% that you can expect just from charting and observing the mucus signs. Now, when they combine that with the nanotechnology science, which is the cooperative medical approach to treatment, they've seen success rates much higher, up to 80%, successfully achieving and carrying on a pregnancy. Again, that depends on the conditions involved, but very, very beneficial. So what is nanotechnology? It is a science that devotes the medical, surgical, and allied health energies and attention to cooperating with the natural procreative cycle. NAPRA technology identifies the problems and it cooperates with the menstrual and fertility cycles by producing treatments that correct the condition, promote normal healthy function of the woman's body, and sustain their procreative potential. NAPRA technology differs from the artificial reproductive technology in many ways. It supports the dignity of marriage and the family. It works to identify the true problems and the conditions that are involved and to treat them rather than bypass them. And with NAPRA technology, the incidence of those multiple births and prematurity are very in comparison to the artificial methods. And that is very important in reducing the risks to both the mother and the child, as well as it also follows in the teachings of the Catholic Church in regards to humanae vitae and donum vitae. And that's an integral part of that specialty is the upholding of the morals, the values. Now with NAPRA technology, it allows the doctors to target the hormones when they do their testing so they know what they're looking for and they get accurate information to assist them then. It may involve expert ultrasound evaluations and various surgical approaches that may utilize laser technology or microsurgical applications, and even things like anti-adhesion strategies to help reduce scarring after surgery. So it's very scientific, very well researched. Oral contraceptives are often used for contraception, but also for a variety of medical conditions that the physicians don't know how to treat. They just have a simple put them on the pill kind of solution. It's very disturbing, I think, to see the medical profession's disinterest in looking for the actual underlying cause for the woman. It's a Band-Aid approach for solving the problem without really looking into it or treating the problem. And I can say I've experienced that personally when looking for some answers for a family member and being told by the doctor, oh, just put her on the pill, we'll be fine. That wasn't a good enough answer for me though. While the infertility treatments in that reproductive medicine field typically don't look for the underlying cause, it leaves the women and the couples without an answer. They're still wondering what's wrong with me. There's not a good answer. When with the NAPRA technology, we look at it, fertility is not thought of as a disease. It's a normal, healthy thing. To look at the menstrual flow and the fertility cycle is how women are created, and it's a good thing. But at times it can become dysfunctional and abnormal. What are some of the common reasons that a woman's put on the birth control pill? I mean, I find that it's often for women with menstrual cramps that are very severe, irregular cycles, irregular or heavy bleeding, or even just recurrent ovarian cysts. So how does the NAPRA technology work? So because the Creighton model is based upon biological markers that include not only the cervical mucus, but also the absence and the presence of various types of bleeding patterns, we can use it to help monitor and maintain the reproductive and procreative health of the woman. Now this investigation over the years has led to the development of the NAPRA technology. Most of this work has been done in Omaha, Nebraska at the Pope Paul VI Institute for the study of human reproduction. So after many years of evaluation of these charts, they found that these biomarkers have been shown to reveal the presence or absence of different types of pathological abnormalities, and they help to give the physician a handle on what's going on and allow for the proper evaluation of the woman's cycle. So this allows us to look at these abnormalities in a cooperative rather than a destructive or suppressive manner. We want to look at it and try to support fertility. So although the biomarkers for the Creighton model are not 100% correct, they are strongly suggestive of various problems or underlying situations. So it helps to guide us in how do we look for what's going on. So when they identify it, I can suggest them they see it as a healthcare provider that's familiar with this, to allow them to guide their evaluation process and come to a realization of what's going on, and then eventually treat whatever the condition might be. So just a few examples of how this might look with the NAPRA technology. So women that struggle with premenstrual syndrome, they may have what we call decreased beta endorphins levels, a hormone level that might be low. So sometimes with just giving progesterone cooperatively with when the body would time it naturally,
we can help support that and help reduce those symptoms. Sometimes they'll use what's called HCG, which is human gonadotropic or human chorionic gonadotropic hormone. Again, it's timed with the cycle. Or a medication called naltrexone. It's an opiate receptor antagonist. Those are all things that support the woman's body. And they also find there's a relationship to PMS with people who have infertility issues or even their risk for a miscarriage. So again, these things can tie into other realms of situations as well. Another one that I see quite often is what's called polycystic ovarian syndrome or polycystic ovarian disease, where women present with a long irregular cycle pattern, and that can have implications in other areas besides their fertility. Reading through it, you can have more serious things like a 7-fold risk of heart attacks and heart disease among those women. So it can be a risk factor for other things, as well as increased cancers and predisposing them to diabetes. So it can look at the whole health of the woman to treat it. Another thing is just the menstrual cramps, trying to treat that, help women to go on in life and not be so miserable with some of these symptoms that are not normal. So those are just a few examples of the NAPRA technology, which is unique to the Creighton model fertility care system. So just kind of as a little summary, we had Jenny and Brian coming to me at the beginning of my talk. So after learning to chart the Creighton model, we referred them to the Pope Paul VI Institute. They went there, they said they had just an entirely different experience. They felt they were listened to, that they were important, that their concerns were real, they were given respect. She had a thorough evaluation done, and she ended up going through hormonal treatment and shortening of her fallopian tubes. She had thyroid support, progesterone, and this HCG, and this Luna procedure, which kind of severs one of the nerves to decrease her pain from all her premenstrual cramping and things. So for the first time, they felt like someone really cared about them, and they actually tried to help get to the bottom of her fertility issues. They also sensed a strong moral, spiritual support through the Pope Paul VI Institute, which was huge for them as well as for all of us that work with them. So they really appreciated this, and even though they weren't Catholic, they saw the immense value in this. So 2 months later, after she had gone through surgery and was starting her treatments, they conceived and they had a healthy baby. They were so thrilled with this. It was really a blessing for me to work with them. And I can say they're on that journey again now. Their son's about 1.5 years, and they're looking at a little more supportive treatment to continue on. Again, they feel very blessed with all that they've learned, and I really think we can reach a lot of couples with that aspect. So when couples struggle more with complicated cycles or medical issues, that is one niche that the Creighton model can be supportive in, which is I very much appreciate that part of it. One thing that's a little bit different from the couple-to-couple league is that I teach on my own. If my husband were to have gone through the training, he would have had the same exact requirements education-wise, so in all practicality, we didn't both take on that 13 months training, but he's very supportive, but it's a one-on-one session. The couples for the requirements come for 5 follow-up sessions after that initial introductory session. So it's one-on-one with each couple, very private, very individually tailored to them. So I do get to develop that relationship, but they have a few more classes in order to get through it. I still get them through 3 months of charting, and then they have their requirement done, and we still encourage follow-ups long term, maybe once a year, or depending on their situation. So that's the Creighton model fertility care system.
Thank Bill for coming and presenting to us, and for the presentation last night. It was wonderful. The only thing is I understand that you like nature just from your presentation. And North Dakota has beautiful nature, but not today or yesterday. So, initially the seed for natural family planning was placed in the 1980s probably earlier than that, because my grandma had 14 kids, and I come from a community of 800, and everybody wants to have 5 kids. So I'm blessed that way, if not more. And so my couples are all very familiar with fertility and having multiple children, and so I'm blessed in that aspect. It's the medical community that I'm fighting with prior to them coming to me. I'm a nurse, and so I know what goes on in the medical community, and it's kind of a sour taste for me at times. But anyway, in the 1980s, initially, I was doing my marriage pre-marriage instructions, and I was given, I think it was like a couple hours of couple to couple. And because I was a nurse, I was working like 12-hour night shifts, 12-hour day shifts, and the couple that taught me, obviously, is not the couples that are in here, but because they just said to me, well, you can't use this, but didn't give me other options. They just said, you can't take your temperature every day when you're working nights and days. And so as a nurse, I just kind of tried to figure it out on my own, and hence I have 5 children. But so I didn't get it right all the time, but I wanted to have a large family, so it wasn't a burden on me. And about 5 years ago, Father Ross Lamframbois, who's up here in Fargo now, approached me and another gal to teach the Billings method. And I investigated different options for myself, like Creighton and things like that. And for me in my life, this was a really good fit. I didn't have to go to the training. That was a big deterrent, but I liked the science and the medical aspect of that. But Billings kind of touches on that. So it was kind of forced on me. And when I got the teacher training, I was overwhelmed, totally overwhelmed. I just did not think that I could ever do this. I think I cried all the way home, because I was like, there's just no way I can teach this. It's so much to it. But it really is pretty simple if you just put it in perspective. And then I didn't teach for about 1.5 years, because the other lady that went with me in our small community, we don't have a lot of couples. I mean, it's like probably 10 couples a year that get married. But then she herself was on her, I think, 6th or 7th child. And so she kind of just handed the baton and said, you have to take over now. And so I was forced into teaching after 1.5 years of education. And so I'm taking a lot of my information that I'm talking to you about what the Billings method is on the Billings Ovulation Method book, and also the Billings, the BOMA USA online, and billingslife.com, billings.life, whatever. So the book, when I first started teaching, I really didn't even notice the book, the outside of the book, but the whole basis on this is the book cover. This chart was made by a couple. I don't know if you guys can see in the back. This chart was made by a couple who was teaching Billings ovulation method for many years. They would place stickers. By placing stickers, the women would use a symbol of a red flower for menstruation, a dry twig for a dry day, and a twig with green leaves when the mucus began, and a beautiful flower to mark the peak day, which is the most fertile day of a cycle, and means to these people a child. This was in a rural community down in Africa somewhere. And so after wearing the symbol in her hair for the day, she would tie it to a piece of string and hang it on the doorpost for her husband to see when he would come home for the evening. And this simple chart records the essential observations required for fertility and regulation, and reflects accurately the normal, complex hormonal, cervical, and vaginal physiology. So you can see for somebody who does not have a high education or is illiterate, this Billings method is a really good method for them because it's very simple. It's, there's 4 rules to it, and there's no temperature to take, no checking of the mucus. So in the beginning, I'm just going to read now. In the beginning, Billings, from 1953 to 1960s, Dr. John Billings of Melbourne, Australia, and his wife Evelyn began work on a method of natural family planning for his priest, because the priest came to him. He was a physician, was not even a medical physician. He was like an OBGYN. He was like a neurologist. And the priest came to him and said, "Can you help this infertile couple?" So he started investigating, and which involved observations of several indicators that signal fertility or infertility of the woman, and later he was focusing on the patterns of cervical mucus, and the main component is the sensation as the primary focus of our method, is patterns, looking for patterns and looking for sensation. And I attended an international conference in Florida just this past June, and their main point that they wanted to bring out, these international physicians from Australia and Spain, is that a healthy, normal hormonal cycle is health. And women don't have health anymore. And the sensation, it takes 5 milliliters, which is like a teaspoon of mucus, to produce a sensation, and 15 milliliters of mucus to see it. So in 5 milliliters of mucus, you can sense it. And so that's what they're trying to get the woman to do. So Professor James Brown, I'm going back to history now, Dr. James Brown and Professor Eric Odeblad contributed their research and scientific evaluation with close to 1 million studies measuring hormone values in relation to cervical mucus patterns. And so that's still ongoing. And one of the signal that they encourage women to look for is lymph node. The lymph node will be swollen in the groin of the ovary in up to about 70 to 80% of women. They can feel a lymph node that's swollen in the groin of the ovary that's releasing the egg. And so that's just, I don't know if the other methods look for that. But women, when I remember way back thinking, oh my God, I think I have cancer because I have a swollen lymph node down there. And then it was gone. So if I would have known that, I think I could have picked up, you know. And so if a woman has only one ovary, she can tell which month she's going to be fertile, because if that lymph node is swollen on that one side, that's the ovary that's going to produce the egg. Billings is very user-friendly. It's a simple method of natural fertility awareness. It doesn't require a woman to do anything that she would not normally do throughout the day. There's no internal exams, there's no temperatures to take, no finger examinations of the mucus, and no clinical office visits, which can add up to money. Women simply train themselves to be self-aware throughout the day, making note of fertile cycles as they go about the normal part of their day. It takes approximately 4 minutes out of their day every day to recognize the sensation of mucus. Teachers may prefer this method as it is less teacher dependent. We now have 2 apps that the couple can download onto their phones. They can share with their partner. It's NFP Online app and the Fertility Pinpoint. And they can provide, and they share that app with the teachers. And I'm still under a teacher supervisor. And so my couples also share it with her, so she can double check if I have a question. The World Health Organization has shown trials in which 90% of women can identify their fertile phase and the peak day of fertility within the first month of observing and charting. I don't know, who they were studying, but if somebody has not been placed on a birth control pill or given artificial hormones, most women have a normal cycle if they're not influenced by other things. That's what I'm finding also in my community, is that if they have not been placed on anything artificial, they see it right away. And a lot of times in my community, because it's a rural community and lots of farmers, they know it before the wife. And my grandpa used to say he could smell it. And he had 14 kids. So besides the simplicity of this method, there is also the fact that it is very inexpensive. There is usually a one-time fee, and we give 3 individual lessons. I like to do a month apart, but depending on how time is allowed before their marriage prep is out. I like 3 cycles, and then lifetime membership, they can come to me. It is highly scientific. They have over 50 years of research, and I think a lot of the methods are kind of based on this, and they just take it to another step. They add the temperature, and we recognize all those things, we just don't teach them. There is usually a small fee, like I said. I'm sorry, I lost my place here. There's no supplies such as fertility strips or follow-up office visits. Billings is a method that focuses primarily on the women's sensation and the importance of thinking in hormone patterns. There's 4 simple rules that we teach them to avoid or achieve pregnancy. They have a high success rate. It's 99%, like most of yours. There was one other thing. Then I also attended an international conference put on by Billings internationally in Dallas a few years ago, and they did, the doctor, Dr. Mary Martin, she works in Oklahoma, and she is a really good support system. She is paired up with endocrinologists in her area or in the United States, and so they're really good support for us. But she did talk, when she got up and she talked, I'm thinking, okay, my first time at a convention that size, and she gets up and she's like, okay, what's the #1 killer of women? And I'm thinking, I don't know what everybody else is thinking, I'm thinking, breast cancer, cervical cancer, whatever. And she said heart health, just like you mentioned. Women are not recognizing that if their hormone patterns are out of whack, that they're generally not healthy, that something is off, and they need to reset themselves. So that's all I have.
And I teach the Marquette method of natural family planning. Natalie is the instructor. She teaches the same method here at St. Anna Joachim, and I have great admiration for her because she was a student of mine before the requirements for the diocese. She came to me where I was teaching out of First Choice Clinic and get instruction, and I encouraged her to be an instructor herself. And we had, through First Choice Clinic, we held a beginning instructor's course for nurses, and she took it and finished it and completed it. And then she went into a doctorate of nurse practitioner program, and so she is an NFP only nurse practitioner here in Fargo working at Sanford, and I'm so proud of her because she's just really the future, I think, for NFP, for the church, and for women and couples health in general. So I wish she could be here. She would have done a much better job. I actually have taken off a couple years because I've been focusing on prevention. I'm a registered nurse, and I have background in community and public health. And as I saw women come into the clinic, both for pregnancy, crisis pregnancy, and teaching NFP. Many of them were just didn't understand or appreciate the gift of fertility, and so I would try to educate them. And what I'm doing now is working at the Newman Center as a parish nurse, and we have a fertility education program coming up on campus in February, and I do kind of ongoing counseling to women. A lot of young girls come in and, you know, with their complaints of different menstrual issues, and I have to say it's been very worthwhile, because I'm able to tell them, don't go into the doctor for this. You know what's going to happen if you go in. This is perfectly normal. Your cycles are going to get back on track, and they usually do. And I know if they would have went into into the health clinic, they would have been given a prescription of the pill and think they should have taken it. So I'm doing a little preventive work that way, and but I'm hoping to get back into teaching, although I've been off from it. So Marquette University School of Nursing Institute for Natural Family Planning is where this program comes from. It was developed in the 1990s, I think about 1995. Again, a priest asked Dr. Richard Faring, he has a doctorate in nursing, to develop this method and to kind of keep up with the high-tech methods that are offered in birth control. And so he's used, the unique thing about this is a couple things. It's only taught by medical professionals, whether it's a doctor or a nurse or a pharmacist or a physical therapist. And it would be nice to have a couple arrangement. I think that's like a husband and wife team, but it's not a requirement to teach. If I teach a class next semester, my husband promised me that he would teach it with me, and he is a physician, so it'll just add more credibility, because he gives a great talk on what the pill does to a woman's body. Because it's taught by a healthcare professional, we just adapt it to the needs of the couple. And things change through a woman's life. And so we teach basically the 3 biomarkers, the ovulation method or cervical mucus. And then we also temperature, if they are interested in doing that. And then the third unique one is the fertility monitor. It's a clear blue fertility monitor, which is produced to help couples achieve a pregnancy, but Marquette has developed a method of natural family planning to help couples use it to postpone a pregnancy. Basically, it's a urinary monitoring of hormones, and it picks up the rising levels of estrogen in the female urine, or the byproducts of it, about 4 to 5 days before ovulation. And then it picks up the LH surge, which happens about 24 hours before ovulation. So you have about 91% chance of pinpointing ovulation using this biomarker of the fertility monitor. It's something that the men kind of like to use, because they can read it out and do all the testing, and they love, it's because it's kind of a gadget. But I just find being a nurse is very helpful, because so many of the couples I taught were on the pill, so you could tell a woman, no, it's okay, this is what you need to do, and you're going to find, your mucus signs are going to be irregular, but this is okay, this is normal. And I think I was able to instill confidence in getting off the pill for them. And also I would help with other areas of nursing intervention, like diet and exercise for different issues. We advocate the fertility diet by Harvard School of Public Health, and that's a really very interesting study about diet and exercise, especially when related to PCOS, and I just recommend it in general to young women. Let's see, breastfeeding protocol using the monitor. I had a lot of women and couples who were using other methods, but during the time of breastfeeding found it very difficult. And Marquette has done a lot of research in this, in using the monitor for breastfeeding protocol, because, as you know, the signs during breastfeeding can be quite challenging. Marquette offers online charting and consultation, and they also have developed a new app. And another interesting part, Dr. Faring, who heads up Marquette, helps with a pre-conference at the Catholic Medical Association, where it's a gathering of NFP instructors from all over the United States, and they meet for a day before the annual Catholic Medical Association meeting to share ideas and updates and research. And he and Teresa Natari, the head of the USCCB, had that up, and I've been blessed to be able to attend those, and it's been very good. So thank you. Any questions?